Audio Jungle.
It depends on where you live in terms of the physical interactions that people can have. Grandparents tend to be of older age, and we want to make sure that they don't have exposure that's risky to them. I'm not talking about shielding, but I'm saying there needs to be this risk-based approach. In certain areas of the world, transmission is under control. Transmission is brought down to such a low level that societies are opening up, and grandparents and grandkids can be with their grandkids. And get those cuddles in. And in some areas where transmission is intense, there may need to be some, restriction of contact for the moment, for the time being. Even right now, before we have a vaccine, we have tools right now that work. And all of those tools will get kids with their grandparents again.
Grandparents are also hugely important in the lives of their grandkids. Their kids, and they're contributing members of society. They're not people we just need to take care of and put in a gilded cage and protect and take care of them. You don't want to be put in that position. But when there is intense community transmission, and where we don't understand where the virus is, and where you don't know your risk and you don't know where that virus is, then one has to be extremely careful. So I would advise, in areas of high community transmission right now, parts of Europe and other places where the disease is not under control, the people over 65 really, really have to think twice about putting themselves in situations where they may be exposed. And that may involve limiting their contact even with extended members of their family. And again, I know that's a tough message, but I think it's one that has to be clear.